Governance is, what are the principles that govern it, and how they relate, or how the concept of health governance contributes to improving population health outcomes. What are the institutions involved in health governance, and who are the people involved in health governance, and then the challenges and opportunities for health governance, and then what frameworks can we apply in assessing health governance. So those are the objectives of this presentation. So when we talk about health governance, we are basically looking at how the health system can be responsive, accountable, and transparent, and accountable. So what are the processes that an institution, a public health institution, for example, what processes does it engage in to ensure that we have it running in an accountable, transparent, and equitable manner? Okay, so we are basically looking at saying, like, we have a public health organization A, or a health organization A. That health organization has the management, but also has the governance board, or what we can call the health boards. So what processes, what procedures, what policies does the health board follow in order to achieve the objectives of these healthcare organizations in the healthcare system? So basically, this is to say that we have a healthcare system. For example, in South Sudan, we have different healthcare organizations. We have different government agencies that are related to health. So how are these agencies, how are these healthcare organizations involved in governance issues? So how do they ensure quality of healthcare services? How do they ensure transparency? How do they ensure accountability? How do they ensure that resources are used in the most appropriate way for sustainable reasons, or for sustainability reasons? So that is basically what we call health governance. Okay, so it looks at the different structures, the different actors, or the different institutions involved in guiding and overseeing the health system. Okay, you need to remember that the health system, it comprises of blocks, according to the WHO, blocks of the health system, where we have the human resource, where we have the financing, where we have the data or information systems, okay, where we have the infrastructure, where we have the governance or stewardship. Okay, so and then we have the pharmaceuticals and medicines. All these are the blocks of the health system. So how do we oversee the different blocks through the different agencies or organizations that carry out these functions? Okay, so you realize that we have a variety of organizations or healthcare agencies involved in the provision of health services to the population. So all these entities, whether they are non-government organizations, whether they are government organizations, they play a role. So when we look at health governance, we are basically looking at this multi-layered system of organizations working together to make sure that they improve the health of the population. Okay, so you can have very big organizations at the global level, and then we have organizations at the national level. You have organizations at the local level. Okay, and therefore across the different levels, we have different agencies, we have different actors that make sure that we have quality healthcare services being provided to the population. Okay, so these agencies or these entities can include ministries. We can include agencies like the Food and Drug Authority. We can have councils, the Nurses Council. We can have the Council for Physicians or Doctors. You can have agencies like the pharmaceutical of the drug and the Food and Drug Authority. You can have agencies such as the National Bureau of Standards. All these are different agencies and they have their own different um, governance boards. Okay, so we can look at all these agencies and look at how these boards are formed. How do the boards relate with the stakeholders, the communities, and things like that. Okay, even the hospitals themselves. Okay, national hospitals, state hospitals, all these have boards. NGOs, whether national or international, they have boards. Okay, so we look at all these actors and institutions at a different level. And then, so we look at the different processes and mechanisms. How do these health boards actually carry out their functions in terms of overseeing the execution of the mandate of the healthcare organization or of the hospital? So issues to do with accountability, issues to do with regulation, issues to do with compliance, budgetary allocation, accountability, transparency, community engagement. How are these things done? What are the processes and what are the mechanisms? Okay, so when we look at the nature of the health system, we look at all these entities. How do they execute their roles? So what entities do we have? Who are the main actors? What mechanisms and processes do they actually employ? So the boards are very, very important. The key thing that I've just talked about is overseeing. Okay, overseeing the different public health entities or healthcare organizations or even agencies. They oversee their activities. Like they look at how are the different activities being carried out. Are they being carried out in the most appropriate way in terms of accountability, in terms of appropriate utilization of resources, in terms of bringing the change that is desired? Or are they actually doing the right things that they are supposed to do? Okay, so that is oversight. Okay, health boards provide oversight. They provide a framework for decision making. Okay, so these boards, of course, um, play an important role in decision making in terms of uh, the structuring, the human resource structure, in terms of the financial structure, in terms of ensuring that there is accountability, ensuring that the finances are actually used in the most appropriate way, and there is no issues of corruption, issues of misuse of resources, and things like that. Okay, so decisions on how these resources are being used is part of uh, the roles of health governance. Using resources in a sustainable way, okay, it's also very important. Building engagement and community trust, it's a very, very key. These boards also provide strategic direction. Where should the organization head? What are the things that need to be changed in order to make sure that the agency is actually moving in the right direction? Um, how should it adapt to the current changes that happen in the environment in which this agency is actually operating? So that's why health governance is actually very, very key. Okay, so here I think this slide is supposed to be the roles of health governance, not the importance of health governance. So the health boards do a number of roles. Of course, you should realize the levels of management, where we have the health board, and then the person who links the health board with the management of the organization is the CEO. Okay, so the CEO communicates with the board. Okay, so usually the CEO is actually the secretary of the board. Okay, so the board can actually decide to fire the CEO, the chief executive officer, or they can actually, after firing, of course, they can actually they recruit a replacement. Okay, so the board plays an important role in deciding who the CEO of the organization will be. So it keeps the CEO in check. If the CEO is not performing according to the expectations, then they can be fired. Okay, they can be fired, and then another person is recruited. Okay, and then the other issue is that the board can approve the annual budget. Okay, of course, this part is related to issues to do with the accountability and transparency. Okay, so if the board does not approve annual budgets, then there could be loopholes for misuse of resources. And then the board also reviews and approves major organizational decisions. These are usually strategic decisions. Okay, the board is not responsible for the day-to-day running of activities within the organization, but they can make decisions on strategic matters. So issues to do with expenditures, loans, getting loans, getting leases, all these are very important decisions that are made by the board, not the CEO and the management team. Okay, so they evaluate whether to see whether the organization is actually on its path. Okay, to see whether the organization will be able to achieve the strategic goals. Okay, in terms of either revenue generation, in terms of whether it is about sales, depending on the nature of the organization. Okay, and then the board also elects other board members. For example, if we have a board member who resigns or a board member who dies, the board can decide to replace them. Okay, and then of course they meet regularly on scheduled basis. The board meets regularly too, and obviously they meet to get reports, either financial reports or annual reports, to see how the organization is operating. So it's based on these reports. That's when the board can decide to make decisions, the ones I've called earlier on strategic decisions, on what direction or which direction the organization needs to take. They also make bylaws and also update them at the same time. So the boards can be public boards, if they are, if the officials of the board are appointed by the government. So, for example, if you talk about the Food and Drug Authority, that is an agency for the government, and therefore it has its own board, and the people on that board are appointed by the government. Okay, or usually they are appointed by the president. And then you have private organizations. They also have their own boards. Okay, so they are elected by members. It can be shareholders. It can be the stakeholders appointing the members to boards of private agencies or organizations. And then we have non-profit boards. Okay, this one, for example, our NGOs or international NGOs especially, they have governance boards. Sometimes the membership on these boards is by voting. okay, where members of the organization elect representatives to the board, and therefore they become board members. And this one can usually take 3 years. You can be on a board for an international NGO for like 3 years or 5 years, depending, okay? So you can also have a non-profit agency or organization where the founder decides to basically pick who can be on the board. So the people that can be on the board on a non-profit organization can be people from the private sector. It may not necessarily be people who are working within non-profit organizations. And then we move to the different categories of public boards. Okay, we can have what you call a honorary boards, where the board is not it does not have legal powers. Okay, so it is not a legally binding board. It's just giving advice. It's called, can be called advisory boards. Okay, they give advice to the executive management team. They are appointed to these positions because of their social standing or financial standing and willingness to contribute some amounts to these boards if they have very strong resources, if they have um, some resources that they can give to the board. Okay, so that is the advisory board. Their decisions are not legally binding, so they basically give advice. And then we have fiduciary boards. These ones are the ones that have legal responsibility. And these legal responsibilities are outlined in the articles of incorporation and organization bylaws. Okay. With these boards, it is not necessary that they actually have sizable number of people who represent the community on these boards. Okay, so the last type of public boards are the ones where there is a representation requirement, where a majority of the board members come from the community where the organization is actually based. Okay, so that is what makes them unique. For them, their emphasis is basically that representation. Okay, so the boards, if you are in a position of constituting a board, if for example you started your organization and you want to have a board, a board governance body, okay, what do you really need to note? One, which I've not put on this slide, is that you need to look at issues to do with the gender. Okay, you don't need to have a board consisting of all male, and this is one of the problems that we have in our boards, different boards. You can have 12 board members and there is no female. Or you can have 12 board members and only have one female or two. So you need to look at gender. And then the other issue is about the number. How many board members do you really need to have? This may depend on a number of factors. So there is no fixed number of board members, but you can look at the size of the organization and perhaps the complexity of the organization can really help you to choose. Okay. The challenge is if you have a board that has many people, then decision making becomes a challenge. So you will face a lot of challenges when you have a very big board. So having 12 as the average, or maybe 6 or something could be appropriate. But just you need to note that the more you have many board members, the most likely you're going to have problems, challenges. Okay. The other consideration is that you can have board members that are actually appointed by the government officials. Okay, and then you also need to note the nature of the organization. If it is a community-based non-profit board, then you basically know that the majority of the board members will come from the community. So if you are the manager, you need to know how you're going to relate with the board. The board can be very tricky. So you need to know the techniques of maintaining your relationship with the board. So, of course, if you have board members who are appointed by let us say, by government officials, and they are appointed onto the public health organizations board, they may not really be cognizant of what public health is, what the organization is after. It is your responsibility as the CEO to make sure that they actually get to understand the mandate of the organization, what the organization thrives to achieve. If you don't do that, they will not basically have an idea on what the organization is doing. So it is very crucial that you educate them such that they learn about the organization's objectives, mission, and and other things that are very important. The other challenge that can happen is if you have board members who are not very active. You may need to go out of your way to make sure that you engage with them such that they really participate in decision making. So you need to engage them actively. And then you need to be a person who can listen to what the board members are saying. Try to listen to understand what they are leading the organization to, or what their ideas are. This is very, very important. The other challenge is that these board members may not have a lot of time on their hands. So if you are actually to have them in a meeting, then make sure that you respect their time. Then this is to say that if you call for a meeting, you don't need to waste a lot of time. Provide them with the reports in time such that when you meet, there is a optimal utilization of that time. So it is very, very important that you understand that the board members may be extremely busy people, and that you really need to make sure that you don't waste their time. So that is very, very key. You can have a board that has different committees. This is the other consideration that you really need to look at, that within one board you will have different committees that look at different aspects. Let us say financial committee, you have committees on strategic planning and things like that. For the board to work effectively, if you have different committees, or even without these committees, these board members need to know their roles and responsibilities. Okay, the secretary, the chairman, and the members, each of the members of the board need to know what their roles are. Okay, so that is very, very important. If you decide that you have quarterly board meetings, make sure that these meetings actually happen. They are very important in governance. They also provide the opportunity for evaluations and see what is moving in the right direction and what needs to be changed. And then we look at communication, effective communication with stakeholders. Okay, we already talked about have actively listening to board members, but part of that listening is actually part of what you can term as communication. Okay, so communication is very, very important between the board members, but also with the stakeholders. And then continuous improvement and the adaptation is also very, very important as a best practice for governance. So if you have been chosen to be on a given board, you need to exhibit these competencies. One is that you should be having the ability to think in a strategic way and being able to communicate what you think this organization needs to achieve in a strategic direction. So being able to communicate vision for the organization is very important for board members. Communication, like I've said, if you are the CEO and you don't have proper communication skills, then the board may not actually understand where you're driving the organization. And of course, we already said that the board has the powers to fire you. Okay, so you need to have proper ways of communication, or you need to have the communication skills and interpersonal skills that can allow you to relate in an appropriate way with either the board members, or if you are the board chair, of course, communication is still very important. If you are the CEO, still communication is very, very important. So you really need to know these dynamics. Decision making and problem solving, some of the competencies that are required of board members. They should be able to delegate work and also work together as a team. This is very important. They should be knowledgeable about financial matters and how to manage the risks. This is very important. If the organization goes for loans or leases, they should be able to interpret the financial implications of this. Board members should be people of good standing in the community. With this is that you don't want to have a person of bad record on the board. So you need to have people uh, who are having integrity and and conduct themselves in an ethical way. So in governance, it is very important that the following principles are actually maintained. And I've talked about them over and over again. Issues to do with the accountability, transparency, equity, the rule of law, and then participation. I've talked about these over and over again. You need to make sure that um, the board promotes transparency. If the board does not do that, then you will have issues, okay, with governance of these institutions. So we have tools and different frameworks that we can use to assess health governance for different health systems. One of those tools is the one by WHO, the WHO Health Systems Governance Assessment Tool. You can check for it on the internet. It looks at, if you want to look at the governance situation, the health governance situation in a country like South Sudan, you use that tool to basically come up with the governance issues in the country or in a given health system. And then, of course, tools such as data analytics. Data and analytics can be very important um, in decision making at the governance level. Okay, decisions made by the board need to be supported with data that comes from different sources, of course. And then community engagement tools, how do you make sure that the community participates in governance matter? So we have tools that can be used: participatory budgeting, citizen juries, community health councils. These are all important structures that can be used in promoting community engagement. Okay. So what are the opportunities that exist to improve health governance? The use of technologies such as the data that I've just talked about. These are very important in decision making. Encouraging participation from different communities is also an important avenue of promoting governance. And then building partnerships and collaborations and creating networks with different sectors and boundaries is very important. And then strengthening capacities and leaderships for health governance. And then lastly, promoting a culture of health that values prevention, promotion, and protection. So that marks the end of our presentation on health governance.